Good afternoon, everybody. Today is October 29th. My name is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Our website is falmouthma.gov. I post some COVID information on that site. There's a COVID page there. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So we had a pretty good week this week. We have 2,065 cases since the beginning of the outbreak, with 20 over the past 7 days and 4 probables. That's definitely a better week than we've had the last 2. Our positivity, so that's the number of positive tests, and divided into the number of total tests, is 2.77%, which is almost a whole percent drop from the previous data. Now, the positivity and the daily incidence rate is given to me by the state. I wouldn't know how many tests are done until the state gives me this report. So the data is based on 10/10 to 10/23, and actually since 10/23 we've even gotten better. So that number is actually the 2.77, and the 15.8 incidence rate is both on a downward trend because the data from 23rd, I haven't had, it's been 6 days or so, 5-6 days since the 23rd, and the cases are actually staying in that low range, so that's good. So we're actually in a downward trend from 277, at least as of the last 5 or 6 days from this was pulled. Again, our incidence rate dropped from 19.7 to 15.8. What does that mean? That means if this is based on 100,000. So what is our daily case count if Falmouth had a population of 100,000? So right now, this over the 2 weeks time frame, it would have been 15.8. The easiest way to look at that, if you're tracking this, is to divide by 3, because we have roughly 33,000 people in town. And so if you divide by 3, that comes out to about 5, average 5 a day. You multiply that over 7 days is 35. We had 40-something last week. And so if you take for that time frame, around 40 cases and 20 in this past week, and it captured a little bit of this week, and yada, yada, yada. The average was about 5 cases over that that time frame. So again, the reason why they do that is because 100,000 people makes everybody a level playing field. So a Wellfleet with 5,000 people in it can be compared to Boston, for example, by its incidence rate, and that's based on if both city and that town had 100,000 people in it. So in some towns over 100,000, you'd be adding to that number. Okay, so here is our case tracker. You can see on the far right, we had 3 weeks where it went way up. Then it went way down, started happening pretty good. And then we had 2 weeks where we started to creep back up. 1 week we would creep back up, and then 2 weeks, the last 2 weeks, we've actually started to come back down. So that's a good sign. I think that 20 to 40 seems to be where most of the time our cases end up with our high vaccination rate. Again, the flatter this line, the better. We were on a little bit of an upward trend, but that's starting to flatten up. So the last time I got this data from the county was on the 22nd, so it's a little later than usual, but this is the last time the county submitted this to me. But the interesting thing for this chart is you can see we had a spike up around the holidays in green, again in the spring in blue, but you don't see a spike even though you have Delta showing up, and we know Delta spreads a lot better than regular COVID. The old-fashioned COVID, you don't see a spike. You see more of an ebb and flow at a lower level, and that's got to do with the high vaccination rates not causing it. And I think that number these numbers would be really high, way higher than the green sort of peak that you see if we hadn't had a vaccine at the time Delta arrived. So, and plus we have no guidance. So without any guidance and separation, again, mask mandate, you see the dotted red line. We lift the mandate, the cases drop down to nothing. Delta starts to show up in mid-July. But we don't get a huge spike. We sort of get this elevated but not spike, not immense sort of number, and that's got to do with vaccination rates helping us with Delta. As far as hospitalizations go, we've had a similar week. Again, the last time I got the numbers from the county was the 22nd. Shows 2, week before 2, week before that 2. So the hospitalizations are in a great place, a good place for us. And so we're not having any surge issues. And again, that could be the same 2 people. It may be. So we're not seeing a lot of hospitalizations. Again, great sign. Statewide, it's been relatively consistent. It's been in that sort of 12, 14, 13 sort of in the last week or so. The positivity's been knocking on over 2. It's been on the low end. It's been at 1.5, probably 1.6 to 1.9 over the last few weeks. The deaths have been stable, so it gets the state it's been pretty level to starting to drop a bit. can see the trends. It's all decent trends, knowing that Delta's around. It's still getting to people. There are breakthrough cases. There are cases of unvaccinated. But it's at a manageable state. And this is what they promised with the vaccines, and it is working. Looking at comparing our peers here on the Cape, you can see that all of Massachusetts averages 17.5 as an incidence rate. Falmouth was 15.8, so less than the state. So we're somewhat middle of the road, maybe slightly higher than most towns, right around the middle of the road, though, so for incidence rate on the Cape. And as far as positivity, all of Massachusetts 1.76. We're still a little higher than that, 2.77. But still, we're sort of middle of the road, not in a bad spot for the rest of our peers. And Wellfleet still had sort of the highest over the last few weeks. They've had some issues. In terms of, I like to show this chart and give you a peace of mind a little bit. Fully vaccinated individuals, only 1% of all vaccinated people have gotten COVID with Delta around and everything. 0.04% have been hospitalized, and 0.09%, have had deaths. There's been 406 deaths, 1,600 hospitalizations among 51,000. I did forget to put that in. It's usually around 3.5% hospitalization rate, and a death that's usually is around well under 1%, 0.7, something around that range. So again, vaccines are very effective. We definitely had higher hospitalization rates among cases and higher deaths among cases without the vaccine. So again, just re-emphasizing the effectiveness of the vaccine. As far as vaccination rates, we remained at 74% for the Cape. Our vaccination, we had a really good week. We had 311 doses administered during the week, 211 first doses, which is encouraging. That's people getting it. I think part of that's got to do with employers starting to require it. And we had 100 second doses, with most of the gain being in the working age, that 30 to 64 had seen the biggest gain, which again would indicate to me that this might be driving the mandates of employers over 100. Requiring the vaccine, you're starting to see that kick up. So we went up 1%, so it's 91% of eligible residents have had at least one dose, and 82% of eligible residents are fully vaccinated. Now, I'll be talking a little bit about 5 to 11-year-olds. So when 5 to 11-year-olds are eligible, that number will drop, obviously, because it'll start at 0, and those numbers would go in there. So you'll see a dip in the percentages of vaccinated among, that will be the same for total on residents, because the upper number, the one that says, 82 and 74, that's of eligible. That's of all people. Down below, I kept track of eligible. Those numbers will actually drop at the lower left. And then we'll catch back up as some 5 to 11-year-olds choose to be vaccinated, or their parents choose them to be vaccinated. Vaccines still readily available. I'm pretty sure you could probably get an appointment. Well, with the storm, maybe there might be a little bit of a delay. I'm sure there's been a backlog. Thinking about the storm we had this week, but without the storm, I can tell you that you can get a vaccine the same day you apply. You go on to a VaxFinder, go on to CVS or Walgreens or Roscoe at Shaw's or wherever you would choose to get a vaccine. So they're readily available. So you can. We still encourage the homebound. So if you know someone who's homebound, you take care of somebody who's homebound, you need a homebound visit. We've had a few calls. You would call the health department, 508-495-7485, and we would send out the VNA to do a house call. We'll be doing clinics as needed. We've done some at the eligible senior housing. We could start doing that as well. We'll do some school-based ones, again, especially as the 5 to 11 vaccine eligibility comes in, so we'll be able to do that. Testing is we still have the school-based test and stay. The Convenient MD still does a ton of testing, as does CVS, Falmouth Hospital. Fairgrounds is still open 4 to 6 Sunday and Thursday, as far as I know. Community Health Center does some testing as well. We're still testing over about 1,200 to 1,300 people per week. Booster doses, this keeps changing, so this is the newest one to let you know. So vaxfinder.mass.gov, again, is where you can get your booster dose. Pfizer and Moderna, if you're 65 and older, 18 or older if you live in long-term care settings, okay? 18 and over if you have certain underlying medical conditions, and then when you go on the state site, it'll list them. And 18 and over if you work in a high-risk setting, and I'll cover that in a second. Okay, so this is new too. Is people who have received the Johnson & Johnson vaccine, you're eligible for a booster dose 2 months after your initial dose. It's 6 months for Pfizer and 6 months for Moderna, 2 months for J&J if you're 18 or older. And this is also new. If you got your second Pfizer or Moderna shot at least 6 months ago and you meet the eligibility, you can get Moderna, Pfizer, or J&J now. If you got a J&J shot at least 2 months ago, you can get any one of the three. So basically what they're saying is you can mix and match your vaccines if you choose. You can get the same one if it's been 6 months from Moderna and Pfizer. If you've had J&J and it's been at least 2 months, you can go out and get any one of the three. Okay, so that's relatively new. If you hadn't heard that before, that's relatively new. This comes from the state. I think they put this on their website on Monday, so I didn't have this last week. So you definitely have plenty of opportunities, and you can pick any of the vaccines in which you choose. You would not be getting 2 shots of Pfizer because you've got J&J. So if that question comes up, you'd get a single booster dose, and it'll be a single dose of any one of the three. What's those high-risk work settings? First responders, educational staff, so teachers, support staff, daycare workers. Teachers can get it. They can get it on their own. Also, the school, I believe, is going to had one today for teachers that wanted a booster. Food and agricultural workers, manufacturing, corrections, postal, public transit, grocery store workers, and they'll update the list. But that's what we had last time I checked it during the week, and so you can get it. So if you either have meet the eligibilities on the previous slide, or you in one of these areas for work, you are eligible for a booster dose. And then again, Pfizer, I think 5 to 11s. We should be really soon being able to stop vaccinating this age group. I think it's already it's pretty much set. I think this is some more voting or paperwork or whatever has to happen. But 5 to 11-year-olds very soon will be eligible. Pediatricians will be one place. They have the state's contacted pediatricians' offices, and your pediatrician will be one spot. Okay, that you can get it. And we also plan to use the school-based ones, either using the Barnstable County Health Department or the VNA, probably the Barnstable County Health, because that's what we've been doing clinics at the schools currently. But they'll be able to do clinics as well. I think most parents probably maybe want their pediatricians, but some may not have a pediatrician, may be new to town, may have some reason why they wouldn't have a pediatrician. So the school will be able to take care of those that can't get it through the pediatricians, or just prefer to do it that way. So we'll have that option there as well. So that'll be an option coming very soon. Again, about face coverings and mitigations, this slide I've had for several weeks. Falmouth has a mask advisory as of this past May. The state and the CDC, unvaccinated should. The state requires masks for public transportation only, or if you're unvaccinated. And they recommend also that you would wear your mask if you have a weak immune system or have you're high risk. CDC, they want you to look at, and on the next slide, on whether you want to have further mitigation strategy. I'll talk about it on the next slide. And schools, I think they just expanded that till after this 2021 till January, a requirement for schools to have a required indoor mask mandate. So our metrics, again, this is the things that we look at, the Board of Health, myself, on determining whether we need to have further mitigations like mask mandates. We're in the low to moderate as far as our transmission. We're on a downward trend in the low of the moderate section for incidence rate. We're low in the low category for percent positivity. Our hospitalizations have not been an issue, and our vaccinations have been super. So 2 out of the 3 we always have the bottom. We always have the vaccination in our favor. Hospitalizations have been good for a long time. We've had some ups and downs, but we're not at a healthcare stress capacity at this point for COVID. And our infection rate is well below the substantial or high, and that's where the CDC recommends further mitigation. So at this point, we plan, at least at this point in time, we're still at a mask advisory, and that's where we are with that. And again, flu clinics, I just want to let everybody know. I put it there should be in today's paper as well. It's on our website. But November 8th, 11 to 1, at the Senior Center for those over 60. We're going to have high-dose flu vaccine, and it'll be available for those 65 and older that request it. Call the health department. We have 2 people in the health department that will be answering your phones. If it's busy, if no one answers, just leave a message and your phone number. We'll call you back. It just happens to be we might be on the phone with someone else. But again, 508-495-7485 to schedule it. Request the high dose when you call us. You need to be over 65. That way we know the VNA is going to be doing the clinic for us, and we'll know how much high dose to bring and so forth. So again, if you're over 60, you can go to that clinic. Over the age of 6 months, the clinic that we generally always run is also going to be, it's going to be on November 15th. It'll be from 3 to 6. We do it later in the afternoon to catch those that might be working. That's at the Gus Canny. That's at the rec center. For anyone 6 months age or older, no high dose is going to be at that clinic. It's going to be regular. And we like you to call by November 10th. If you can call by next week for the one on the 8th, that'd be great. By November 10th, you also call the health department. We'll have it pre-register you. We want you to have a completed vaccination form. You can either get it on our website, the health department page. We can mail it. We'll have blank forms there. It just makes it a little bit quicker. If the forms are filled out, they take a few minutes to fill out with your insurance information and all that stuff. So it just makes it a little bit quicker. Please come to the clinic with a form if you have it. Your insurance card you definitely should bring. You want to have short sleeves under your jacket. That way, again, makes it easier for you. And we have a mask advisory indoors. We do like people to wear masks. We'll have a lot of people that come to this clinic that might be high risk, so we ask you to wear masks. So those are the 2 clinics, and they're going to be pre-registered by calling the health department. We do that because we do have a lot of seniors that want these, and it's a little bit more difficult in an online registration program for some. So we're just going to do it by phone, sort of the old-fashioned way. By having you call, we'll register you that way, and that's what we have for the flu clinics. And also, again, you don't have to wait for these. In the old days, maybe 15 years ago, pharmacies couldn't get them, so you'd have either your doctor would give it to you, or you'd have a clinic at the health department. We would be running clinics, and there would be different ways of getting it. Right now, if you want a flu shot today, there's plenty of openings. Again, storm aside, there may be some changes to that, but with power and all that. But generally speaking, when we don't have a weird week like we had this week, flu shots are available at Walmart, Shaw's, Stop and Shop, the CVS's, lots of other places. So you can just get them that way. So there's plenty of opportunity for it. Now the high dose you might have a little trickier getting. You may want to come through us for the high dose. Because I don't know if everybody carries that, okay? Again, as a recap, case counts dropped this week, and I hope it continues that way. 5 to 11-year-olds, eligibility very soon. 3rd dose, we talked about that. You can mix and match. Anybody who's had any type of vaccine, Pfizer, Moderna, 6 months out, you can get boosted if you meet the requirements, and 2 months, same thing, if J&J. J&J doesn't have those requirements as well, so I think it's anybody J&J. So, Falmouth residents, anybody who got the J&J can get a booster after 2 months, so that's good. Falmouth residents' vaccine rates again are great. Vaccine breakthrough does occur, like we said, but it generally doesn't result in serious illness. And again, with the 8th of November for a senior center clinic with high dose, and the 15th at the Gus Canny for 6 months and above. Okay, call us the health department again. So that's what I have for an update this week, and we'll plan to do one again next week. Thanks.